And now it is my pleasure to introduce our panelists. So our first panelist will be Allison Sonnenschein, who is a founding director of the OC Women's Health Project. Allison has over 25 years of nonprofit, legal, and volunteer experience in women's health. In 2011, she founded the Orange County Women's Health Project, a nonprofit dedicated to advancing local women's health through education, collaboration, and advocacy. Prior to the OC Women's Health Project, Ms. Sonnenschein was the Special Projects Officer for the Mirage Foundations, where she helped establish the SOS El Sol Wellness Center, now a federally qualified health center located at El Sol Academy, a Title I charter school in downtown Santa Ana. Prior to that, Allison was a litigation attorney with Bingham McCutcheon, now known as Morgan Lewis, in Los Angeles, where she performed pro bono legal services in the reproductive justice and domestic sexual violence movements. Ms. Sonnenschein has served as a board chair for both Essential Health Access and Planned Parenthood of Orange and San Bernardino counties. She graduated with honors from the University of Pennsylvania and earned her JD at the USC School of Law.
Great. Thank you so much, Aurora. Okay, to begin, we are going to, first slide, please, talk a little bit about what is the current state of COVID-19 in Orange County. We've done this at all of the summits, and I think it's particularly important today as we're going to be exploring the policy implications to understand how COVID-19 is affecting the county. So next slide, please. So the first slide is actually just a reference where you can find information and resources. The Orange County Healthcare Agency is maintaining a dedicated website for COVID-19, a referral telephone line that operates during the week, and a variety of resources that you can download and link to concerning the case counts, testing sites, frequently asked questions, the state and county health orders and recommendations we have a separate link to on this slide. And finally, the data, not only the case and death counts, but also how these counts are being tracked by gender, by race and ethnicity, by age, and by city, as well as what's happening with the number of tests that have been administered, the number of folks who've been hospitalized, are in the ICU, and who have recovered from COVID-19. Next slide, please. So as of yesterday, Tuesday, June 9th, we had 7,614 cumulative cases of COVID-19 documented in the county. I just want to acknowledge that when we started the summit on May 29th, we had about 5,744 cases documented at that time. So we've seen an increase of almost 2,000 cases in the last 10 days. And as of today, 49% of those cases are among women and 51% among men, 0% unknown. So that tracks pretty closely to the population overall in Orange County by gender. It's slightly more than 50% female and slightly less than 50% male in Orange County, according to the census figures. So this skews a little bit opposite, but pretty close. In terms of the death count, as of yesterday, we had 185 cumulative deaths from COVID-19 documented in Orange County. That's up from 145 deaths recorded on the first day of the summit on May 29th. But here we see a slightly more pronounced disparity among men and women. And in fact, it is men who are bearing the brunt of COVID-related deaths in Orange County. We can see there's 44% of COVID-related deaths among women and 56% among men. So men are more likely to die from COVID-19 than women. And this is not true just in Orange County, but also throughout the country. We are seeing a greater impact in terms of the mortality rates among men than women. Next slide, please. Now, this pie chart illustrates the breakdown of COVID-19 cases as of yesterday by race and ethnicity. And I just want to qualify or issue a caveat that, as you can see, the bright blue section of this particular pie chart shows that 27% of Orange County cases, we don't know the race or ethnicity. That's such a large percentage of the overall number of cases that it suggests that the rest of these numbers are not that reliable. And so I wouldn't draw any firm conclusions. These figures are changing daily, but with such a large quantity of unknowns, we really cannot determine to what extent there are racial and ethnic disparities at play with regard to the case count. We are seeing cases and deaths affecting African American men in particular at the highest rates throughout the country, but we haven't seen that materialize just yet with the data we have currently available in Orange County. Next slide, please. So this pie chart illustrates the death count. Now here we have more reliable information because, as you can see, only 1% of the deaths in Orange County related to COVID-19 are unknown. And you can see it's a pretty wide distribution of deaths among the various races and ethnicities in Orange County. And this breakdown tracks pretty closely to the demographic breakdown by race and ethnicity of the overall population in Orange County. And if you're interested in doing that comparison yourself as we move forward, you'll see that I've included links at the bottom of each of these demographic slides where you can find the overall Orange County population breakdown by age, by gender, and by race and ethnicity. So you can see how the COVID case breakdown and COVID death breakdown is tracking against the overall population breakdown. Next slide, please. Here we have pie charts illustrating the COVID cases and deaths by age in Orange County. And this is a really interesting set of charts. We all suspected that and in the early days of COVID-19, it was established that our senior population, ages 65 and older, were at the greatest risk of COVID-19 complications and death. And in fact, that's what's playing out here in Orange County as well. If you see on the chart on the left, I realize these numbers are really small and tough to read. So if you click the links at the bottom, you can get to the original source and you can expand them. But as you'll see on the left side, the case distribution by age, 77% of all COVID-19 cases are among adults ages 18 to 64. But this same age range, adults 18 to 64, represent only 25% of COVID deaths. And the opposite is true for our seniors. And I'm defining seniors here as 65 and above. About 20% of the overall case count in Orange County is affecting seniors, but 75% of all COVID-related deaths are among this senior population. We do have a very small number of children ages 0 to 7 who have contracted COVID-19. Thankfully, 0 deaths among children ages 0 to 17 due to COVID-19. Thank you. Next slide. Finally, the Orange County Register is publishing on a daily basis a map that illustrates by city the case rates. So what you can see here is that the cities that have the highest case rate per 10,000 residents are highlighted in the darkest of the red shade. And that appears to be concentrated in the central part of the county. Santa Ana, Anaheim, and Garden Grove have the highest central county case rates. But we also see in the chart on the right-hand side, just the case counts, where we have a slightly different ranking. And interesting, so in other words, it is not always the case that a city with the highest case rate is also the city with the highest case count. That is true at the very top of the list, but as we move down, we find that a slightly different ordering. And one standout example, Los Alamitos, which doesn't even appear on this list of the cities with the highest case count, has one of the highest case rates. So the register is tracking this daily, and you can link to that yourself at the top link on this slide. Thank you. Next slide. So that is an overview of where we are today in terms of how COVID is playing out in the county. I would like to take a moment and just discuss at a very high level, why are we even bothering to talk about the policy implications for women? It's because women are facing unique challenges related to COVID-19. Next slide. So there are a variety of areas where women are experiencing a disparate impact from COVID-19. Domestic violence. There is an increase in family violence happening right now as people are sheltering in place. At the very beginning, the first week or so of the shelter in place order, we're talking about the second week of March. Interestingly, the calls to domestic violence and hotlines and the calls to law enforcement for domestic violence related assistance went down. We believe that's because domestic violence victims were now being forced to shelter in place with their abusers and were unable to find a private time or a private location to make a call. But as we've adapted to these shelter in place orders and as we've moved through time, we've seen the number of calls increase exponentially, especially to domestic violence hotlines in Orange County. And this has obviously long-term repercussions with all of the health-related consequences and desire for legal and housing assistance for these domestic violence survivors who have been forced to live and shelter in place with their abusive partners. The second area where we're seeing women impacted uniquely is, of course, with pregnancy. So there's some medical evidence that women who are pregnant are at higher risk for serious complications from COVID-19. And of course, the top question for any pregnant woman is, if I get COVID-19, am I going to pass it to my baby? And so far, there's almost no evidence that that is likely to happen. There have been about 4 studies of pregnant women who have COVID-19 at the time they deliver. And across those 4 studies, granted the number of patients involved in the studies are very small, but fortunately of those, across those 4 studies, there were only 3 newborns who tested positive for COVID-19. However, we don't know whether the newborns contracted COVID-19 in utero, during the childbirth delivery, or after, by being exposed to someone, whether it was the mom or even a healthcare provider who may have been contagious. So there is little to no evidence of vertical transmission in utero, but it is certainly possible. The other good news is that there's been no evidence of COVID-19 being found in breast milk. Excuse me, the third area where we're seeing a disproportionate impact on women is in the area of caregiving. So schools are closed, childcare facilities are closed. Grandparents and aunts and uncles who often contribute very meaningfully to childcare are sheltering at home, and grandparents in particular are at higher risk and have been advised to stay away from children. And so for working parents, this is causing a tremendous strain in that children who are now having to do distance learning often need, especially if they're younger children, they need some help from their parents to get onto their Zoom or whatever the virtual platform is. And we're finding that this burden of child care and caregiving is falling disproportionately on the moms. And especially in single parent households, which in this country are overwhelmingly headed by mothers, by women, when they have no other childcare options, this means that they're going to have no choice but to take on this additional childcare responsibility, often to the detriment of their own productivity or employment. We're also seeing this on the other end of the spectrum for adults who care for their elder relatives and for older adults. And it plays out both ways. On the one hand, you have adults who are providing caregiving responsibilities for seniors who now are responsible for doing the grocery shopping, picking up the prescription drugs at the drugstore, maybe making additional meals for these seniors. And so there's additional time-consuming tasks associated with this caregiving because seniors are sheltering at home. But on the other hand, if seniors are in a facility that's under lockdown, there's a lot of guilt and mental health issues associated with adults who are typically responsible for caregiving now being unable to fulfill those responsibilities. So whichever way it cuts, we're seeing impacts on women who are overwhelmingly responsible for caregiving, both for children and for seniors in this country. This also relates to the fact that women constitute the majority of the essential frontline workforce in this country. And as caregiving responsibilities increase, that means that women's ability to fulfill their employment responsibilities is put into jeopardy. It also means that women are taking on additional risk just by going to work because they're not able to shelter at home. And we're seeing that in certain sectors where women constitute the majority of the workforce, like hospitality, retail, hotels, restaurants, they're suffering a disproportionate percentage of job loss and wage loss associated with the reduction of hours or being put on furlough. And for those who have employer-based health care, then they're losing their health insurance as well. These disparities affecting women in the frontline workforce are even more pronounced for women of color, who represent the greatest percentage of the frontline essential workforce. Women of color also suffer a double pay gap disparity. So women overall are paid less than men, and women of color are paid even less than white women. And so for women of color in the frontline workforce, they are experiencing significant disparities when it comes to job loss, wage loss, health insurance loss associated with COVID-19. Finally, I just want to acknowledge that during a pandemic, we are finding that women are foregoing their preventive care. This is true across the board because medical practices have had to close for all but urgent visits, and it is just more difficult for people to justify taking the risk of going out in order to seek preventive care if it's not truly urgent. But what does this mean? Last week, we learned that in the first few weeks of the shelter-in-place order, that visits to the STD clinic run by the county, by Planned Parenthood, and Radiant Health Centers all dropped by about 50%. In the weeks since then, the visit counts have increased pretty steadily, but what we're seeing is that people are not going in to get screened, tested, or treated for STDs. Fortunately, all of these providers have been able to adapt, and they're now offering contact-less telehealth visits, drive-through visits, and a number of STD tests can actually be performed at home and sent into the lab. So we do think that this is changing for the better. Unfortunately, on the other hand, women are unable to seek screening mammograms, and well woman visits during which a pap test would be performed are also temporarily suspended. So in this sense, women are forgoing their preventive care, and we don't know for how long this is going to last. Next slide, please. This is just a quick infographic that illustrates that women are the essential workers in the sectors that are being affected most by the COVID-19 pandemic. You can see here, this is based on data from the American Community Survey, that women represent 75% of people who work in hospitals, 88% of those who work in psychiatric, nursing, and home health aides, and so on. And I just want to acknowledge that this is different than what we've experienced in the past. In the last Great Recession of 2008 and prior recessions, the industries that were affected most by job loss and wage loss caused by the recession were male-dominated industries, such as manufacturing, in particular auto manufacturing in 2008, as well as construction, in particular home construction and building improvements. These were the industries that were most impacted, and as a result, it was men who were disproportionately impacted by job loss and wage loss and the loss of health insurance. This is different this time around, and it is women who are being disproportionately impacted by the COVID-19 pandemic and the ensuing recession.